Good morning, everyone. Welcome back to PFRANKMD IGTV. And today we're going to talk about the chin because a lot of people are coming in and asking about things like Kybella, liposuction, fillers of the jawline, Botox of the neck. There are so many things we can do now below the nose to tighten and lift. But certainly one of the most common complaints is that pocket of fat along the jowl and underneath the chin. And understandably, people want the least invasive treatments that are possible. A very popular drug that's on the scene right now is Kybella. It is marketed almost like Botox as a form of injectable fat reduction. And it has added value to the neck sculpting scene, so to speak. There are some, side effects and innuendos of treatment that people do have to know about when they come in. I don't personally use much of it in my practice. One of my areas of expertise is in microcannula, tumescent, and laser liposuction. I'll get that into a second. Actually, a procedure I developed called UltraTight. But Kybella is an injectable treatment. It's usually used around this area. It is something that takes several treatments to get a significant difference. It's not a one and done. And unlike Botox or fillers, it's not really a lunchtime procedure. It can be uncomfortable to get. It does cause significant swelling. It is something you have to take off a few days from work, or if you're in front of a camera or speak to people. It is not a 1, 2, 3 procedure. And the fact that you have to get it done a few times, it may actually cut into your lifestyle quite a bit, because if the average patient needs 2 to 5 treatments and every time you do it you look like a frog for a week, it can be a problem. Now, some people don't have a reaction as much, but the people who have more fat are usually the ones that have the more reaction. So that tiny little pocket may have a little bit less. So it's important to speak to your provider. I wanted to talk about a procedure that I perform, that I've been doing for 20 years. It is a form of microcannula tumescent liposuction. We call it UltraTight. I developed a little cannula years ago. It's an internal ultrasound device that helps melt fat through a very tiny hole and tighten the skin from the inside. It's predictable, it's safe, it's a 24-hour recovery. It's actually performed purely under local anesthesia. You can see this on my website, everything about it. We do a lot of posts about it. And that's one of the reasons why I don't really do much Kybella. Because first and foremost, it's a very safe treatment. It's performed under local anesthesia. It's done through a stitchless hole that you'll never see right under the chin. It's very much like going to the dentist. You feel about 30 seconds to 2 minutes of discomfort due to the Novocaine, and then it's like getting your teeth cleaned. You know something's going on, but you're not bothered by it. It takes me about an hour in my OR, and we put a bandage, we wrap you up for 24 hours before you could take it off, and we send you home in an Uber or a car service. You could even get on the subway. It doesn't require any significant sedation. It's safe, it's predictable. I could really get rid of 80 to 90% of the fat and tighten the skin from the inside. You're not getting that from any number of Kybella treatments. Also, with Kybella, you have to be careful in certain areas around the jowl near a particular nerve that can cause a temporary type of droop of the mouth. We really never see this with the tumescent liposuction. I've never seen it in several thousand cases, because we have the control and the sculpting effect. We know where to go, where to stay away from. We're not just injecting blindly. So there are pros and cons to both. My patients like a one and done. They're happy to do a quick 24-hour or weekend-like procedure recovery. And most importantly, they want to know if they do the procedure that they're going to get that 90% reduction and make a dramatic and permanent change in their jawline. Other things that we add to the procedure, we will often, after we remove the fat pad and the skin, build the jawline with filler. We can use injectables like fillers and Botox in the neck as well. These are all the ways that we're going to get around having to do surgical intervention more aggressive, something like a neck lift, or more traditional liposuction, which is a more aggressive procedure. So my ideal patient is someone with mild to moderate laxity in the jowl and the neck area. The UltraTight procedure is something you can watch a video on my website. It's a bloodless, painless procedure. We've never seen infections or blood loss. And I really think it's a great way to make a permanent difference while we do other things that may have maintenance. Ultimately, there are some people who need neck lifts. Plastic surgeons are not going out of business. I think with any procedure, it's about choosing the right candidate. Whether you are choosing Kybella for those little areas, whether you're coming to see me for the UltraTight, or whether you're someone that really needs that bigger neck lifting procedure. So it's not just what you do, it's how you do it, picking the right candidate and making sure you have the type of professional that's choosing the right person for the right procedure, and then is skilled in all the options that are available. Because again, if you only have a hammer, everything looks like a nail. Make sure you go to a provider that does a little bit of everything, and hopefully you'll be able to see that right here at PFRANKMD. So thanks for joining. I'll see you soon.